We're now live. You can go ahead.
Thank you so much for joining us today. Before we get started, we'd like to begin with a brief message from Gilbert Martinez from our communications team for our Spanish-speaking viewers. Gilbert?
Buenas noches y bienvenidos a la sesión informativa organizada por la supervisora Hopkins y la doctora Mase. Esta sesión informativa se está transmitiendo en vivo por nuestro canal de YouTube con interpretación al español. Para escuchar la versión en español, puede usar el link de YouTube que se encuentra en la página de Facebook del Condado de Sonoma. Gracias. Ahora regresamos para atrás con supervisora Hopkins.
Thank you so much, Gilbert. I'm Lynda Hopkins, supervisor for Sonoma County's 5th District and chair of the Board of Supervisors. Welcome to our COVID-19 and vaccination community briefing for Wednesday, March 10th. Today, we're going to cover a few things. Number one, we're going to cover Sonoma County's status in the blueprint for a safer economy, including the new state changes regarding the tiers and what that means for us for our long-awaited move into the red tier. Second, we're going to cover the latest on our allocation of vaccines and where we stand in our transition over to Blue Shield, our third-party administrator, which will soon be in charge of vaccine distribution throughout the state of California. Thirdly, we're going to follow up with that and jump into the latest CDC guidelines on what people can do once they are fully vaccinated. But first, I want to take a moment to address something that many of you have already heard through the media and discussions on social media. Yes, it is true that our Director of Health Services, Barbie Robinson, soon will be leaving us to become the Public Health Director for Harris County, Texas, the largest county in the state of Texas. While this is a loss for our county and for our community, we also recognize that this is a tremendous career opportunity for Barbie, and it also allows her to be closer to family. And so we are very excited for her and wish her the best. The good news is that Barbie will be with us until mid-May, which gives our county time to ensure continuity of operations within the Department of Health Services. More important, we'll be moving ahead without any kind of interruption with our vaccine rollout, as well as all other aspects of COVID response. In terms of COVID, the news is pretty good. Sonoma County's case rate is continuing to fall. Unfortunately, however, we missed being a candidate to move into the red tier by literally 0.1% due to the metrics that were posted yesterday. I recognize that that is very frustrating and extremely disappointing and a financial hardship to the many businesses that are hoping to reopen or to increase their revenue through further reopening measures as we move into the red tier. However, there is still a chance that we might move into the red tier very soon, possibly as soon as next week. This is due to a rule change that the governor plans to make as soon as the state administers 2 million vaccines to the lowest HPI quartile. And we are expecting that to be complete very soon. Our health team is going to go into a little more detail about that in a minute because it is a bit complicated. Either way, with our cases dropping and our positivity rates declining as well, we expect that we will be ready to move into the red tier very soon. So hang in there, keep wearing your masks, keep avoiding large gatherings, and please keep getting tested. These remain the best tools that we have to reopen our economy safely and to get past COVID-19 and really turn the corner. I know it's been a long, difficult 12 months. It's hard to believe that we've been in this thing for a year. But the good news is that more and more of us are receiving vaccinations each and every day. Still, it's not the time to relax. I'd now like to turn it over to Supervisor David Rabbitt, who will cover our vaccine supplies. David?
Thank you very much, Chairwoman. Obviously, it's a very frustrating time. We're so close to the red tier for the last few weeks, and I know we're going to get there soon, and it can't come soon enough for so many of our businesses and citizens of Sonoma County. Also, our staff has built an incredible system to deploy vaccines, up to 40,000 shots a week. The problem has always been the vaccine supply. We are only getting about 1/5 or 20% of that number. This week alone, we got 7,700 doses, but 1,700 of those were the Johnson & Johnson doses, which we were grateful for. But to be honest, we were looking to see Johnson & Johnson augment our Pfizer and Moderna, but instead it was in lieu of Pfizer and Moderna. That forced us to, again, concentrate on making sure that we have enough vaccine for second doses, as opposed to getting out in front on first doses. If you look at the data, I think we've come to a pretty abrupt halt with the ability to get first doses out. And I share the frustration there. And after talking to some of our colleagues at the state level, it seems that we might be in this for a few more weeks as the third-party administrator is really concentrating getting vaccines to Central California and Southern California, where the need apparently is greater. And to that extent, I just want to make mention, and I want to thank again our staff. Each and every day, our staff is communicating with the state. And I can tell you that each and every day, your electeds are communicating with their colleagues in Sacramento as well. We are always advocating for Sonoma County. We are always trying to find the angle to either get questions answered, get the information back, put Sonoma County in the best place for success, and quite frankly, with the vaccine, to find more supply. In fact, our health officer and the Department of Health have talked to the undersecretary, volunteered Sonoma County for a FEMA site. A FEMA site is important because that goes beyond the state allocation. That's a federal allocation. So I just want to ensure people that we're always looking for an angle to make sure that we can, quite frankly, get as much vaccine into Sonoma County as possible. But at the end of the day, statewide, nationwide, it is a zero-sum game. There's only so much vaccine available. And like Supervisor Hopkins, I share optimism going forward. We have Merck now in contract to produce vaccine. That'll increase supply over the course of time. And I think we're in for perhaps a couple more weeks, maybe 3, where things may be flat before they start taking off. And I think at that point in time, they'll take off at a steeper trajectory, getting more and more people vaccinated. So again, I ask for everyone's patience as we go forward, as we go through this, not only as a county, but as a state and really a country. You know, and I know I share that frustration, and I know that everyone wants to get vaccinated as soon as possible and be able to open everything up. So with that, I think I'm passing it off to Dr. Mase, and I'll turn it over to her and thank her for her work as well.
Yes, thank you so much, Supervisor Rabbitt and Chair Hopkins, and everybody who's participating today. As Chair Hopkins stated, we are very close to moving out of the purple tier in the state's blueprint for a safer economy. Our adjusted daily case rate per 100,000 residents is now down to 8.2. We needed it to be at 7 to move into the red tier this week, but it is under 10, and that will be the threshold when the new state tier changes take effect. So our overall testing positivity is low, as it always has been, at 3.1%, which puts us in good standing to move up in tiers. But our testing positivity in the lowest quartile of the Healthy Places Index this week is 5.3%. If we had gotten to 5.2%, we would move into the red tier next Tuesday to reopen more of our economy and schools. But as Chair Hopkins mentioned earlier, the state is making the much needed adjustment to how counties can move into the less restrictive red tier. This is incredibly important for our county here at Sonoma County, and a validation of all the hard work that everyone in the county has done during the pandemic to stay safe and keep others safe. California's approach to modifying the blueprint for a safer economy is anchored not just on the level of overall vaccinations across California, but with a particular focus on vaccinating individuals living in the state's vaccine equity quartile communities. That is the lowest 25% at the Healthy Places Index quartile. And that would be the critical indicator then for moving forward. Why? Because the pandemic has disproportionately impacted these communities, and we are painfully aware of that here in Sonoma County. So once 2 million vaccine doses have been administered to people living in the vaccine equity quartile, the upper number of cases per 100,000 for the red tier will be increased from 7 to 10. In other words, as long as our adjusted case rate is under 10 per 100,000 per day, which it has been for the last 2 weeks, we would be able to move into the red tier. Now, the governor expects that the state will finish administering these 2 million vaccines by Friday. In this scenario, hopefully this will happen, the state will reevaluate our data from Tuesday, March 9th, and is expected to reward Sonoma County with 1 week credit towards the red tier. That means the county could formally enter the red tier very soon after that. In fact, the transition to red could happen even sooner than the predicted Tuesday, March 16th. And we'll just keep you posted on exactly what's going to happen as it unfolds. It's just not that clear at this point exactly which day we could move into red, but we're very, very close, I'm happy to say. It's a very hopeful development for our county. What does moving into the red tier mean? It means that more businesses will be allowed to reopen indoors to a limited capacity. That includes restaurants, health clubs, and gyms. Weddings and other cultural events will be allowed indoors with modifications. Other businesses that are already open indoors will be able to expand operations. This is what we all want here in our county. But once we get into the red tier, we want to maintain our momentum and move towards the orange tier and then the yellow tier. So we also need to keep up all of the important hard work that we've been doing to keep us safe during the pandemic. That would be continuing the wearing of the masks or facial coverings, practicing good hygiene, and the social distancing to prevent the spread of the COVID. We also need to continue to get tested. Testing numbers have been down. And as you know, as we've been saying this past, actually the entire pandemic, but especially here in the last month or so, testing is important even with vaccine distribution. Testing helps identify and isolate cases so we can prevent further transmission and outbreaks from happening. Many people that have COVID are asymptomatic, or they have very mild symptoms, and they may not even know that they have COVID. So they may think it's a seasonal allergy or cold, but it's worth getting tested if you have any symptoms, if you feel like you've been exposed, if you're worried in any way that you may have COVID, and even if you just want to get tested once a month, I think that's just fine. We have plenty of testing. You can get an appointment on the same day at the state-run sites like OptumServe. And if you go to socoemergency.org, you'll see that there's many other opportunities to get tested, and it will only help us move forward and open our economy and get back to life as normal. So the testing, by the way, also would tell us if there are any variants of the virus in our community. We don't want to undo all the progress we've made in reducing the spread over the past year. So let's keep our fingers crossed here and move forwards. And now I'm going to turn it over to Dr. Shende, our vaccine chief, for an update on our vaccination campaign and the third-party administrator transition.
Thank you, Dr. Mase. So I'm pleased to say that we continue to make progress in getting vaccines administered to people. As of today, we've administered more than 162,000 doses in Sonoma County, and nearly 28% of Sonoma County residents have received at least one dose, and 12% are fully vaccinated. The big unknown, of course, is how much vaccine we'll be receiving from the state over the next week and the next few weeks. And it's crucial that we receive enough vaccines to at least accommodate all the second doses that are coming due in Sonoma County in the next 1 to 2 weeks. The good news is that we have a third vaccine to administer here, the Johnson & Johnson vaccine. This week we received 1,700 doses, our first allocation of this new vaccine, which only requires one shot. Some of the doses will go to the Sonoma County Office of Education for teachers. I also want to reiterate that all 3 vaccines are very effective and all nearly eliminate the risk of hospitalization or death from COVID-19. That's what we're trying to achieve. We're trying to keep people healthy. And it's important to note that the numbers in terms of effectiveness vary quite a bit because each vaccine, the Pfizer and Moderna and the Johnson & Johnson, were tested at different times. And the Johnson was tested when variants were amongst the communities in which it was tested in. And what's most important is that it was very effective at keeping people out of the hospital and keeping people from dying. We've all been hearing a great deal about Blue Shield's role as a third-party administrator for vaccine distribution in California. And to be honest, there have been a lot of questions about this. It's been a bumpy road at times, but the result is that the transition will be a gradual one, which is a positive development because it allows us to keep advocating for fair and equitable distribution of vaccines in our county. And it allows for us to continue the framework that we've already developed in Sonoma County and continue doing what we're doing. It's important to note that Kaiser plays a role too. They will be playing a part in being able to allocate greater doses of vaccine within Sonoma County and have been identified as a group that can be given codes. And in that way, they have been able to help the Sonoma County Office of Education vaccinate some of their teachers. So they will continue to play a role, a collaborative role in our community going forward. The good news is that we are being heard. We are working closely with Blue Shield on the transition to the state taking over vaccine distribution. We're optimistic that we'll be able to provide vaccines to those important local partners that are not affiliated with large providers such as Sonoma County Office of Education and Sonoma County Medical Association. It's a very complicated process, so we ask for your understanding as it unfolds, but we want to stress that so far it has felt very collaborative. There has been very good communication between Blue Shield and our department. Blue Shield would like to retain the current structure of vaccine clinics in Sonoma County that we've already put in place, and that's very encouraging. We're pleased that Blue Shield's contract with the state emphasizes rapid delivery of vaccine with incentives to ensure that vaccines are distributed within the state's equity framework. Because our priority all along has been to see vaccines distributed in as fair and equitable a fashion as possible. This means getting vaccines to those most in need and those most disproportionately impacted by COVID. A reminder, the state's My Turn appointment system will be used by all contractors administering vaccines. It's not yet fully operational for Sonoma County residents, but at some point in the near future, specifically within the next 2 weeks, almost everybody will be able to use this system to schedule an appointment. If you haven't been vaccinated, we encourage you to register on My Turn and get familiar with the site if you haven't done so already. The state will also have a call center for those who do not have computer access or who need help with registration. I also want to mention the new guidelines from the US Centers for Disease Control and Prevention for people who are fully vaccinated. Although all 3 COVID vaccines are effective in preventing the worst outcomes of COVID-19, including hospitalizations and death, it's still unclear how much vaccines limit the spread or the transmission of the virus. There's still a number of unknowns. And for that reason, the CDC has issued guidance for those who have been vaccinated. The CD guidance is advisory in nature. The state health order is what has final authority in California. At this point, the state has not revised its order or weighed in on the CDC guidance concerning what activities or exceptions are permitted for fully vaccinated individuals. We're waiting to hear how the state will respond. Until then, we encourage everyone to continue to be very careful and to err on the side of caution. We're still learning how vaccines will affect the spread of COVID-19. Even after one has been fully vaccinated, one should still keep taking precautions in public, such as wearing a mask, staying 6 feet apart, and avoiding crowds and avoiding poorly ventilated spaces until we know more. Again, the variants are going to be an important factor going forward. And until we know that we are gaining control over the variants, and until we know that the vaccination rate has significantly increased, we shouldn't have a false sense of security. And hopefully that time is going to come quite soon. But if we all work together, we can continue to keep our community safe. We'll get into more detail on these guidelines later. For now, I will turn it back to Supervisor Hopkins.
Thank you so much for that update, Drs. Shende and Mase. So I would like to welcome Ken Tassif, our Vaccine Logistics Chief, and Adam Radke, Deputy County Counsel, to join the discussion. And I'd like to start off with a question for Ken. You know, there's a saying, a proverb dating back to Abraham Lincoln, don't change a horse midstream, right? You know, and there's a lot of apprehension as we change over to the TPA about what is this going to look like? You know, I'd like to ask you, how are we going to ensure consistency across vaccine clinics? You know, both now and in the future as we move into this new world of Blue Shield as the third-party administrator.
Well, thank you, Chair Hopkins. I appreciate that. Let me share that one of the most recent things that we've done is developed a mission, vision, and value statement that we've shared with the providers. But before I go over that, I'd also like to remind folks about a lot of the things that we've got in place that's helping to ensure consistency at the clinics and a great client experience when the public is out there. We have regular meetings with our clinic providers, and we have a robust field operations team, including liaisons at each clinic that communicate really closely between clinics and the county to ensure that there's consistency. We've provided over 140 clinical staff to the various clinics out there and another over 40 event staff that are helping ensure, again, consistency in the way they deliver services. We're providing supplies and infrastructure at all sites to let them focus on what they do best, which is the clinical part of the equation. And we've also we've got equity support out there. Our clinic staff, our field operations team, and our equity manager work very closely to ensure we have bilingual and bicultural staff, appropriate signage and forms out there, and training to ensure cultural responsiveness. Before I talk about the mission, vision, and value statement, if I could turn it over just briefly to Denia Candela, our equity manager, and maybe she can talk a little bit about how equity is the core of the mission, vision, value statement, and then I'll go through it directly. Denia?
Great. Thank you, Ken, for passing it on. And thank you, Supervisor Hopkins, for raising the question. I'm Denia, I'm your Health Equity Program Manager for Department of Health Services COVID-19 response. And yes, it is absolutely critical to know that our shared values and missions are actually centered around equity. There are equity principles as the forefront of the vaccine mission. You can find the specific strategies and all those different components of the equity framework by going to socoemergency.org. And more than anything, this is the goal and standard across the board for Sonoma County's vaccine rollout, as we're working with our partners to ensure that we're in alignment to achieve such outcomes. Equity, per definition, we'd like to define it as an outcome. And then I'll pass it on back to you, Ken, now to really talk about what is this missions and value statements really look like as we move forward.
Great, thank you so much, Denia. I appreciate that. So in general, mission, vision, and value statement. The mission tells what we do. The vision is where we want to go, and the values are the principles that we operate under as we move from our mission to our vision. So our mission is fairly simple and understandable. We support and promote the equitable administration of COVID-19 vaccine across Sonoma County. As you know, we're not administering it directly, but we are supporting those that administer it, and we're promoting that the public get vaccinated. Our vision is that all the eligible residents of Sonoma County do receive the vaccine, and the values that we use, and I'm not going to go through every single word in this, but I want you to understand the principles. Equity. We'll promote equity in vaccine delivery by supporting vulnerable communities, and this includes ensuring equity is included in our planning and execution of vaccine operations. We'll also have community engagement like this forum right here. We're engaging with the community and proactive communication and outreach so that we can learn more from you and inform you better. We're engaging in healthcare partnerships. And I talked just a moment ago about the meetings that we have just hours ago, literally with all of our providers, but we do this on a regular basis. More than once a week, we're meeting with all of our providers. Access to vaccine centers. We want to work with stakeholders to reduce barriers, both for those with disabilities and those that have traditionally been underserved. And we want to be transparent in information. We want to tell the public or give public accurate information to make decisions about vaccines, provide benefits and risks of receiving the vaccines and let them make their choices, and also talk about our progress that we've made in getting the public vaccinated. And then lastly, and very importantly, vaccine safety. Ensure the integrity of vaccines by supporting our providers and ensuring that the administration of the vaccine is safe for the public. So those are our principles and our mission, and vision and values. And here's what I think I'm very proud of is that the results of that, I'll share another screen. The results are that we continue to do very well amongst similarly sized counties. As you can see, and this is just a ratio, but of our county in the middle of, these are the population sizes of the various counties, you can see that we've administered about 167,000 vaccines, and compared in as a ratio of the total population, that's amongst the very highest of all the counties in the state. So we're very proud of that, and we believe that's a result of following those mission, vision, values, and having great partnerships with the providers.
Thank you so much for that, Ken. And Denia, I'm wondering if I could ask you a follow-up question, which is, it's great that we are leading the charge with respect to our comparably sized counties and vaccination rates. But I think it's also so important to think about the vaccination rates in some of our most vulnerable communities. And Denia, I'm wondering if you're available just to share why it's so important to think about equity when it comes to the vaccination rollout, particularly as it pertains to what we saw with respect to the impacts of the pandemic and the infection rates. Would you be able to just share a few thoughts on that?
Absolutely, Chair Hopkins. I think you bring up just a really overall good point, right? So disproportionately impacts have been the forefront of what we've been trying to address, and acknowledging that this pandemic has really emphasized that. So when we're trying to do and really develop operational strategies or frameworks centering that individual who is undocumented, perhaps it's shelterless, and is also, has challenges in terms of disabilities, it has been really helpful as we center that specific patient or client, if that makes sense, as everything that we're doing in terms of operationally. Equity is in the details and how we really achieve this and do so. So we really are pushing forward to ensure that as we even move forward in this process, we really are able to center that patient and individual too. It is that's going to allow us to then be able to achieve a healthy community and really get through this together.
Thank you so much, Denia. And I know it's been such a focus of the county's work, and we are of course now on the cusp of this transition over to the third-party administrator. I'm wondering if Dr. Shende and Ken, you could comment a little bit about how we're going to keep this equity-centered work going forward as we transition over to Blue Shield. And in particular, I'm really curious how we're going to make sure that some of our targeted clinics, like the ones designed for food and ag workers, keep continuing under this new model.
Thank you, Chair Hopkins. So if I may, Dr. Shende, if I could start, we've been in communications with Blue Shield, and as we've reported in the past, Blue Shield will contract with those providers that are going to be administering vaccines. And we're really pleased to say that Blue Shield has accepted all of our core providers that we've got in place to join the team. The one provider that we will not be able to get to contract directly, the Sonoma County Medical Association, we found contracted providers that are able to take them on. So all of those providers that have been doing this great equity work already, they will remain in place. And Blue Shield has been very cooperative with us in ensuring that that our structure will remain in place. And we've in working with them, we've got the full commitment that those providers will continue to do those targeted clinics and outreach. And Dr. Shende, maybe you could add.
Yeah. And to that effect, the current clinics that have been able to supply farm workers and ag workers with vaccine will be continuing. And so I don't think there'll be much change in that work. We'll also see what happens going forward with centers like OptumServe. We have actually made a lot of progress in vaccinating our seniors. And as we move forward and get through that group, then that can be a location where certain targeted groups that are eligible can continue to get vaccinated. So we have options, and we will continue to pursue that going forward.
Thank you so much. And my next question is for Dr. Mase and also for Adam Radke, just regarding that red tier, right? What's your best guess of when we will get to red tier? And Adam, could you refresh our memory as with, what does that actually mean? What businesses can reopen? How is life going to look like? And then I guess also a follow-up question is that red tier is not our goal, right? That's not the end of the line. We hope to push on to orange. We hope to keep moving forward. So could you talk a little bit about that too, kind of what our future trajectory might be looking like? And I know everyone asks you to look into a crystal ball. I know you don't have one, but we'll just go with best guesses and give grace if we're not quite right.
Yeah, thanks so much. And first of all, let me just say I agree with you 100% that we're not just shooting to get into the red tier. We want to get into orange and yellow, and eventually business as usual. So having said that, I think our crystal ball is better now than it has been in the past. We've seen our case rates dropping. We know now with nearly 2 million doses already administered in that lower socioeconomic group that we're nearing a adjustment in the tier metrics. And that is very exciting, as I said. So again, we can't say for sure, but what I'm going to do is, since Adam, you probably have a really good idea of the different scenarios here, if you could weigh in, and you need Kate to weigh in as well, fine, but and say something about what you see, based on our data, where are we going?
Yes. So we are aware that the governor, Deputy County Counsel Adam Radke, we are aware that the governor announced today that the state expects to be able to meet its goal of administering 2 million vaccines to the lowest HBI quartile group on Friday. If that were to occur, then the state's plan is to assess on Saturday data from the last 2 Tuesdays, and counties that are eligible for the red tier based upon the revised metric for the red tier may be eligible to move into the red tier on Sunday. So there is a plausible scenario because our last 2 weeks worth of data does meet the metric for red tier based upon the state's revised metric, that the soonest that the county could plausibly move into the red tier is as soon as Sunday. Kate, do you have anything to add on top of that?
No, I think that addresses it. The state is getting very close to the 2 million doses. Looking at their data right now, it's up there at about 1,927,000. So it's very close. And so it's likely that it would reach that by Friday, if not before.
And then Chair.
And just Adam, if I could just say, if let's say we don't reach that 2 million on Friday, or somehow it gets extended and we only get 1 week of red tier status counted, then what would be, in other words, the worst case scenario would be, when would we be able to go into the red tier?
Yes, so if the state were to only give 1 week worth of credit based upon, let's say, Tuesday's data from the 9th, we could nonetheless remain eligible to enter into the red tier the following Tuesday, which would be the 16th.
Thank you so much for all of that great information. One last question before I hand it back over to Paul to take questions from members of the public and the press. And that's really, I think that there's a lot of sense of hope right now, right? The vaccination rollout is, going pretty well here in Sonoma County, right? We have some momentum. Obviously, there's this, we feel like we're on the cusp of moving into the red tier. But, I kind of put my mama hat on and say, we're not out of the woods yet, right? This isn't spring break time. This isn't time to go back to, life as normal. And so, I just am wondering if we could talk a little bit about that. And Denia, I'd love to hear that from an equity perspective. I also want to acknowledge that even though we are trying to target our, Latinx and disadvantaged communities, that we still are lagging in some of those communities of color with respect to vaccination rates. So we still do have a long way to go. And I'd like to end on a hopeful but cautionary note. So I'm just wondering, Denia, if you could share a little bit about that. And if Dr. Mase or Shende, you could offer some advice to members of the public who, are feeling hopeful, but just, we want to recognize that we're not out of the woods yet. And it's really up to all of us to be responsible right now, whether or not we've been vaccinated, to maintain those protocols. That's what's going to get our community out of this safely. So Denia, could you talk a little bit in particular, I just want to acknowledge Rosalind and your efforts to, stand up a vaccine site there to really support that work and to also support the testing there. And I want to say thank you for all of that work, but feel free to share a few of your thoughts.
Thank you, Supervisor Hopkins. Really, it's really important and critical that we do consider and speak about the safety around our community, especially those have been the most impacted. We're having a lot of conversations about moving into the red tier, but we have a large majority of this population that is part of our essential workforce. And although they have been part of the priority groups to get vaccinated, it's super important that as we start slowly moving into that red tier zone and, really being cautious about continuing to mask up, get tested, staying healthy, as we are kind of being a more risk for exposure as well, right? Given that this group is part of that essential workforce. So it's always yes, and right, let's stay safe, let's stay healthy. And it's the best way to go about it, to keeping the community healthy as a whole. We want to open, but we just really want to ensure that it's not at the expense of those who have less access to, and it can be more disproportionately impacted by this whole thing. We want to make progress and not go backwards. And I think that's important to note.
Thanks so much,
And
Denny.
let
Dr.
me just
Mase?
add by saying, thank you, Supervisor Hopkins. By saying that we just want to make progress. The red tier is kind of the first success, and then we want to go into orange and yellow. So I would ask everybody, because we only have 30% of the population with at least one dose of vaccine, I really would like to ask everybody to adhere to the extent possible with all of our mitigation measures that you've been following for the past year, until we get to that point where we feel like we have 60, 70, 75% of the population vaccinated and we feel safer. That's one thing. And I just wanted to quickly ask Adam, because Supervisor Hopkins, you'd asked, what does it mean to go into the red tier? And if Adam, you could just quickly summarize the list of activities that would be allowed in the red tier that are not allowed in the purple, that would be really helpful, I think.
Yes, I can give a summary, and there are resources as well on the Sonoma County Economic Development Board website. They will post a PowerPoint there of what changes are expected in the red tier, but some of the ones that are well known are that restaurants can operate indoors at 25% capacity or 100 people, whichever is fewer. Movie theaters can operate indoors with 25% capacity or 100 people, whichever is fewer. Museums, zoos, and aquariums can operate indoors at 25% capacity. Gyms can operate indoors at 10% capacity. Retail stores can operate indoors at 50% capacity. I apologize. Grocery stores can operate at 100% capacity. Wineries where no meals are provided must remain outdoors with modifications. Bars, breweries, and distilleries where no meal is provided are closed. Family entertainment centers can operate outdoors with modifications for activities like kart racing, mini golf, and batting cages. And office workspaces remain remote only work.
Thank you so much for that great information. So now I'll hand it over to Paul to take those questions.
Great, thank you. This conversation has generated a lot of good questions. We want to remind our viewers and listeners that they can post a question by just clicking on the comment box below their screen on Facebook and putting their question in there. And we will try to get to as many as we can. I'm going to start with a question from Robin, who asked a question many of us have been asking over the last week or so. She says, how is it possible that none of the 400 zip codes identified by the state of California deemed most vulnerable are in Sonoma County? Dr. Mase or Kate, do you want to take that one?
Yeah, I mean, that's a very good question. It's determined by the state. And I don't know, Kate, if you have any further detail on that.
I do not.
Yeah, so basically the state looks at every zip code and census tract and makes a determination based on that Healthy Places Index. I'm not going to pull up the slide, but the Healthy Places Index is a kind of a number that's assigned based on many different inputs. That, access to education, access to medical or healthcare, income, many different factors, like 10 different things go into that Healthy Places Index number. And based on that, the different census tracts are just scored. And I think what the state has done is look at the lower 25% to see which census tracts and zip codes fall into that, and none of them fall into Sonoma County. And I will say that here in the Bay Area, we do have a higher sort of standard and cost of living than many other places in the state. I don't know, Supervisor Hopkins or Rabbitt, you may actually be better to address that question some.
I don't have anything to add unless you do, Supervisor Rabbitt. Any other thoughts?
No, I
I'll
think
share that Dr. Shende and I had a brief conversation with some state representatives, and they did state that they believed that some of the census tracts that we would think might qualify had higher incomes than others, and that was the reason that they believed that they did not qualify.
I can state from working on different regional issues where census tracts are important that this happens throughout the Bay Area, partly because of the income disparities and some of the things get lost in translation within that. But if you look at the statewide and some of the census tracts within the state, you can see a significant difference. And I'm sure that has something to do with it as well. I can tell you at the regional level that we've been fighting, ironically, to make sure that we can identify those zip codes, those census tracts, to be able to pull funding into that. But the feds and the state seem to have a very pretty strong line on where they want to call that.
Great, thank you. The next question, I think this is a question, we'll start with Dr. Shende for this. Lee asks, will Sonoma County open the next tier in increments, such as opening it to 60 to 65-year-olds first? And maybe you could explain what the next tier looks like.
Yeah, that would be one way to do it. And actually in January, those are the criteria that we had. It was actually 50 to 64. But the state did want to open it up to people with chronic conditions and disabilities. So as of Monday, the tier is going to actually be ages 16 to 64 with comorbidities, chronic conditions as defined by the state, as well as disabilities. There is also talk that they are going to expand it further. And I understand that from a state call that's going on right now as we speak, that they will have further definition of that expansion coming out either today or tomorrow. So it's going to be a very large tier. And what's important to know is that this expansion doesn't come with any extra vaccines, unfortunately. So there are going to be many, many people who are eligible, and rightly so. However, we still have the same problem of very limited vaccine supply. And so it's going to take a while for people to be able to receive the vaccine, even though they are currently eligible.
Roberta asks, what's happening with Sutter getting their supply to vaccinate their patients that they had to cancel many of their first appointments and some second appointments. She notes she has not received a call from Sutter to reschedule yet. Can we provide an update on that?
So we were told that all of those Sutter appointments would be rescheduled by the 17th, meaning people would receive appointments for their second doses by March 17th. And so what we have been asked to do is to have Sutter patients or those who receive their vaccine at Sutter to call the phone number, the call center, to get more information. We know that they are working on it, and they've been working hard to try and get everybody back in.
Okay, great. Let's go to Phil Barber from the Press Democrat. Phil?
Hey, I believe we're getting 7,700 doses. I'm sorry, we got 7,700 doses this week. Do we know what next week's allotment is yet?
Actually, I just, yeah, as Dr. Shende predicted, we got it during this call. It looks like the allocation that will be coming in next week will be 8,180 doses.
Thanks, Ken. There was a lot of talk about Blue Shield and the TPA system during this discussion so far, and most of it was pretty positive. Can anyone tell me, will the county definitely be signing its Blue Shield contract, or has it already? I know some counties are considering trying not to do that.
Well, I can start, and then Ken, if you want to jump in. So the thing to keep in mind is that counties that are signing a contract are those for whom they have their own county clinics and hospital, so they're able to administer the vaccine. We are not in that category. We will not be a provider. We haven't been a provider. So we would not be signing that type of contract. There are some discussions in the works, both for counties that are providers, as well as counties like ours, for having a separate type of agreement such that we may be able to continue distributing vaccine. They are looking into agreements such as MOUs, memorandums of understanding. But at this point, at no point were we going to actually sign a contract because we are not recognized as a provider. Ken, would you like to add anything?
No, I think you did articulate it perfectly.
Thank you for clarifying that. I appreciate it. Supervisor Rabbitt, you mentioned earlier hearing that one reason perhaps for the flat allotments of late is that Blue Shield and the state are focusing on sending doses to the Central Valley and to Southern California. I had heard that a lot here and there, but without any details. Are you able to elaborate at all on what you heard about that?
Not really, Martin, other than like you. And I think that goes to some of the issues that we've all been dealing with in terms of the communication from the state and really trying to find out what's happening. And through the third-party administrator, the first, second, and third wave, I think it only makes sense that if you're going through a first, second, and third wave, there's a reason why that's the case, and there's consequences within that. So I think one can extrapolate, and then looking at what has been received, what hasn't been received. I think Pfizer and Moderna are still ramping up production. I don't think it's going down or staying flat necessarily, and we've got Johnson & Johnson. So it only makes sense that if we're flat or we're down, if you include on just the Moderna and Pfizer side of things, that vaccine is going elsewhere and not here to Sonoma County. It may make sense. We prioritize within our own county. The state prioritizes within the state. If it makes sense from a medical standpoint, that's one thing. So I can't really elaborate any more than that. Probably what you've heard as well.
Thanks. And sorry,
Phil, could I correct a number, please? I told you 81, I believe 8170. The correct number of doses coming for next week is 7,680. Like I say, it was breaking news. I just wanted to, I went and clarified while I was off screen.
thank you.
And just to add to that, just to clarify, none of that will include Johnson & Johnson. It's only Pfizer and Moderna.
That's correct.
We won't be getting any more Johnson & Johnson until the 23rd.
Oh, okay, thank you. And I'm sorry, one quick one to Ken, if I could. You mentioned the county's current vaccination partners. Looks like you will find a way to bring them into the Blue Shield system. You mentioned SCO finding a medical provider or a contract provider. Does that mean that Sonoma County Medical Association has also found a contract provider or some sort of workaround that will bring them in?
Phil, no, I didn't mention SCO. I mentioned SCMA, Sonoma County Medical Association, and yes, they will. There are a number of contract providers that have offered to partner with them, and we are confident that there will be a partnership there.
Thank you for that clarification too.
Okay, we have a couple more questions. We want to go back to Marissa. One of our viewers says she's looking for guidance on weddings. She says we have already postponed their wedding once, and we are looking they are completely in the dark on our options for a June wedding. Adam, do you want to take that one on?
Yes, and the state actually has the answer on the frequently asked questions website, but an overview of that is that the state distinguishes between the wedding ceremony and the wedding reception. Wedding ceremonies are permitted. They have to comply with the places of worship guidance and restrictions on that sector. So in purple and red tier, weddings are allowed outdoors or indoors at a maximum of 25% capacity. That is for the wedding ceremony. For wedding receptions, that actually falls under the state's gathering guidance and restrictions under the Blueprint for a Safer Economy. So in the purple tier, it is restricted to outdoor receptions with no more than 3 households, including hosts and guests. In the red tier, it's permitted both outdoor, indoor, and indoors with a limit of 3 households, including hosts and guests. You can find the FAQ on the state website under the title about COVID-19 restrictions.
Thank you. And one final question. Sarah asks, she says, I don't understand why if someone who is fully vaccinated still needs to stay masked and distance and follow all the same restrictions. Dr. Shende, do you want to, or Dr. Mase, do you want to take that on?
Yeah, go ahead, Dr. Shende, I can add.
Okay. So the CDC guidelines that just came out do say that if people are fully vaccinated, everybody in the household is fully vaccinated and they interact with another household that is fully vaccinated, then in that case alone, then masks can come off. If one family or a couple or whoever who are fully vaccinated enter the home of another that is mostly vaccinated, but there are still those who, there may be unvaccinated individuals, then it really is with caution because, of course, that unvaccinated individual still could pass it on. So because of this, because of the unknowns, it still is important to be careful. It is true that there's a lot more sense of security if everybody in the situation is fully vaccinated. But it's going to be unusual to have these situations, and particularly in multi-generational households where there are young children or people who are not eligible for the vaccine or young people who have not received it yet. So because we don't have 100% guarantee that the vaccine is going to prevent transmission, it still is extremely important to be cautious and do everything we can to try and prevent spread.
Yeah, so if I can just add on, if even if you've been vaccinated, you could actually still get COVID between the first and the second dose, if it's a 2-dose vaccine, or even after the second dose. There have been some cases where people have gotten COVID. So that is of concern, but also the variants are out there. I'm sure everybody's been reading about the variants, and we're not sure exactly how effective the vaccine might be if there's future variants as well. So in other words, there's some unknowns and it's worth being careful and cautious.
Well, thank you all. With that, I'm going to turn it back to Chair Hopkins.
Yeah, and we're going to end our session there. I really want to thank all of our panelists for joining us today. And I also want to say thank you so much to all of the behind the scenes crew who are so amazing, Paul's team members who make sure that these things come off smoothly without a hitch every week and make sure that we've got all of the latest and greatest information to share with all of you. Also want to say thank you to Jordy, our Spanish interpreter, and Odie, our American Sign Language interpreter as well. And I would encourage everyone, as always, to go to socoemergency.org/vaccine for more information on our vaccination rollout. And finally, one last plea, to that last question, it is so important for us all to stay masked and to stay socially distanced. Remember, the majority of Sonoma County residents have not had access to vaccines. And we continue to fight for equitable vaccine access, but we still have a ways to go. So please, for the sake of all of us who have not had an opportunity to get our vaccines, whether or not you've received a vaccine, please do follow social distancing and masking in public. It's critical to the health of all of our community members. As usual, you can always follow us on Facebook and Twitter for more updates in between these briefings. And we will again see you next Wednesday at 5 p.m. For the next briefing of these. So until then, have a good week and stay safe and keep everybody else safe too. Take care.